let's talk statistics. I think it's
Okay.
crucial as well. The general community members and leaders should be involved in the community health system as one of the stakeholders, I assume. This can be
Yes.
achieved by the hospitals releasing the necessary statistics to inform communities on the progress of community health system. So, for
Mm-hmm.
instance, the local hospital can start releasing statistics on fatalities, morbidities, disabilities, and causes that led to those kind of tragedies. So the statistics can be availed to the community by the very local hospitals. Just for instance,
Yes.
with the pandemic, with the COVID-19, now I can tell you the number of fatalities that are happening. But then
Mm-hmm.
you can look at the local hospital. I cannot tell Mokopan Regional Hospital how many fatalities are there. Is information that is not out there for us, for community members like myself. I cannot tell what's going on. I cannot tell which, maybe, for instance, which kind of chronic diseases are we battling as a local community. And then this
Yeah.
should be that the hospitals that should, avail this kind of necessary statistics to the the general community. I mean, the general communities. That I think
Mm.
this is so important because now, if I know as a general a member from the community, say, okay, diabetes, I think, is a problem. I have to educate myself. Why is it a trend in our community? And then now we will start to sort of, come up with solutions to mitigate or trying to, as prevent this kind of chronic diseases. So why do you think this kind of statistics should be availed to the local communities by the very local hospitals for local communities to engage and improve on their health system?
Okay. Well, first of all, yeah, statistics are available because they are the ones we base our strategic interventions on.
Mm.
They are available to us as health workers. They are available to our heads and also stakeholders involved in advocating healthcare for patients. As for availing to the public, I think we do try as hospitals to avail the information to the public in the form of pamphlets, in the form of health talks, in the form of even just word of mouth, talking to people generally. I think the problem is that in comparison to a pandemic like this, it's it's difficult. It's a difficult one to compare because obviously this is a pandemic. It's an interest of the whole world. In comparison to chronic diseases, which are common in our setting. So it's also, I don't know. It's difficult also to put forward the information to the general public in terms of statistics, because at a certain point, certain health heads would make it seem like you are trying to scare the public, or hey, 80% of you, if you have hypertension, you will develop a stroke and stuff. So instead of releasing the actual statistics, we actually release we review the statistics and then come up with countermeasures to those to the stats that we receive. So making the information available to the public is important. Yes, transparency. I believe in transparency. However, it might seem like you are trying to scare the public.
Okay.
If you are too transparent, yeah.
Yeah, if you are too transparent, be transparent, but not that much. I
Yeah, not
think
that much.
to add to your point, I think to pamphlets and everything else, or the distribution channels, they are there. I think I've seen quite a few. But then, since the world is moving digital wise, why can't we have platforms whereby, you know, maybe on a weekly basis, real time, it might be a problem because, you know, it might need the technical abilities, but it's still possible. But then on a weekly basis, maybe we can have a dashboard. This is an online kind of a thing whereby we can access this kind of information. So I would say that maybe the hospitals, they should, you know, try to look at a digital form of, you know, distributing this kind of statistics. You know, some statistics, of course, I do agree, is quite sensitive. It might scare the community, but I think it's vital as well to be transparent, to say, you know what, HIV, I think, is a problem in our community. I think you should do this and that as health experts. I mean, advising the community, or tailor making the solution according to the statistics that you guys release to the public, to the local communities. So yeah, that was my add to your answer there. But yeah, you're right. We shouldn't try to demotivate or scare the community. We must be transparent, yes, but we have to sort of encourage them in one way or another, you know.
Yeah.
So, yeah.